Hello, I hope this finds you well. My name is Matt Shonnard. I'm a physician in the United States. A little background, I received a combined MD and MPH from the University of Nevada, Reno School of Medicine in 2020. I completed my residency at Baylor University Medical Center in Dallas, Texas in physical medicine and rehabilitation and was a chief resident, and then lucked my way into an interventional spine and musculoskeletal fellowship with Dr. Douglas Beal in Oklahoma. Today I will be presenting on an intradiscal therapy for lumbar disc herniation. I have no disclosures, and a quick thanks to my fellow researchers for allowing me to present this information to you today. So a bit of background. This intradiscal therapy is called STA363. It's a mix of lactic acid and iodinated contrast omnipic. Lactic acid's role in the intervertebral disc has been studied for decades, dating back to the 1970s. It's a known endogenous metabolic agent with a low toxicity profile, and so was chosen as a potential novel therapy. The original STA363 study investigated it as a potential treatment for degenerative disc disease as a sclerosing and stabilizing agent, but found no clinically meaningful differences between intervention and a control group. However, in these trials, STA363 did show a significant chemonucleolytic quality. Specifically, imaging during the STA363 degenerative disc disease study showed a dose-dependent reduction of disc height. These radiographic findings in the context of prior literature and histological data supported this chemonucleolytic characterization, and so a phase 1b trial began in 4 clinical sites in Poland, evaluating the role of STA363 in lumbar disc herniation. The main objective of this trial was safety and tolerability in lumbar disc herniation. 25 patients were followed for 6 months. 17 received intradiscal STA363. 8 received placebo, which was an intradiscal injection of sterile water. We looked at subligamentous protrusions or extrusions that were less than 6 months in duration, but more than 6 weeks. Again, the primary objective was safety and tolerability, with radiological objectives as a secondary. Safety and tolerability in the study were acceptable with no dropouts due to adverse events. 4 treatment emergent adverse effects occurred in 3 patients and none in the placebo group. Those findings are displayed in the table to the right. Interestingly, no new or worsening Modic changes were seen after STA363 injection, which is a unique asset and different than other chemonucleolytics. Results from the lumbar disc herniation study showed that after an injection of STA, significant volume reduction was seen in the disc that was durable through 6 months. We found an 11% reduction, which we hope is predictive of pain relief. The reason I say hope is that the study of 25 patients was underpowered to show any significant differences in radicular leg pain. The reduction in disc height, as you're imagining, was similar to reduction in disc volume and was also durable. We can only say 6 months of durable reduction, but suspect these findings last out to at least 1 year, as we found similar findings in the earlier trial. So, in conclusion, STA363 has been injected intradiscally in 100 patients, including 17 in the study, with acceptable safety and tolerability. STA363 has the characteristics of chemonucleolytic, meaning it reduces disc height, volume, and water content, and it does not induce Modic changes, which is a significant attribute. Therefore, further studies are warranted to determine the effects of STA363 on symptoms caused by radiculopathy due to lumbar disc herniation. Thank you for your time. Hope you enjoyed the presentation.